Good afternoon, this is Dr. Do again. This video is a quarantine special edition, video number 20. I can't believe it. I hope all the videos, the purpose for the videos I posted is not for medical professional, but for the general population with or without medical knowledge and some questions. I hope my video serve the purpose to help you to answer your questions. Or if you have questions, I'll be happy to discuss with you. I'm sure during the discussion I can give you some information, hopefully helpful, and probably I can get some idea from you, so to help me improve and getting better. Okay, today's video, the purpose of today's video is a diagnostic test, because we all came across this fundamental lab results or image results, either ear physical or the problem, and the doctor prescribe you a prescription, not medication, but you need to go to the image or to the lab, get blood drawn to test. This is very basic. We all have this kind of moments in daily life, and especially when we're busy, the test result come back. The doctor knows, look at those and look at whether there is something need to alert you. And you have the copy of the result. And if you're, for those people very pay attention to their health, they probably look at this result. What are those? What does that supposed to mean? So, and also the image, for example, the chest x-ray, you look at the x-ray film, oh, I just know that's my ribs, probably that's the only thing. What you're looking at, what kind of important variables you, as our healthy or young or old, without known diagnosed conditions, what we should look at, either the image or the blood draw, or this is the purpose for this video. Okay, basically, when are these tests done? Usually, for example, if you have a condition, the doctor suspect you have bacterial infection, for example, for those had fever, coughing, seek medical attention, headaches, and the doctor will probably suspect you have bacterial infection or the condition is serious, then that's the time for blood test. For just common cold, for example, but exception for right now because the coronavirus outbreak. I'm not talking about currently, just general practice, and not including the coronavirus. Of course, right now, if anyone have the coughing, nasal congestion, fever or non-fever, you need to be tested. Okay, regardless what I talked. But if you have, if you have fever or without fever, coughing, nasal congestion, you will be tested if you see physician. But I'm just talking in general. For example, in the somebody come to the clinic with a sore throat, and you come to the clinic with sore throat. You're young, you're healthy, and you said you have some cough ups, and along with the color change. So the doctor suspected the cough up sputum is not regular mucus color, it's yellow or green. That usually means suspected with the bacterial infection. So if that's the case, your doctor may or may not do the test. Sometimes empiric antibiotics will take care of you, but for those older people had medical problem, present with this changing color sputum, that means need to be tested, because for those people with medical conditions, history of use medications, need to test for what kind of causative agent, pathogens, what kind of bacteria, and find out the sensitivity for the antibiotics. So if that's the case, need to be tested for the bacteria. And the other test we commonly done in the clinic is the regular yearly physical to test your blood. Usually, what number you're looking for the healthy young people, looking for the cholesterol level, 200, or the number is there. Usually you have 2 columns. I'm not going to tell you the number, you probably will not remember it. One said normal and one said yours. If yours is not normal, usually colored or say abnormal, increase or decrease. So you look at the cholesterol for general healthy people, and there's another LDL, low density lipoprotein LDL. You look at that number, it's very important. These 2 numbers, if it's higher than the normal, that means bad. And you look at the blood sugar, usually it's tested. If it's elevated, means it's not good, or the borderline. Your doctor usually communicate with you. So you, just in case you're something you couldn't make an appointment to discuss the lab, then you just look at the result. These are the numbers you need to look: cholesterol, LDL, glucose, and the other one is HDL, which means if it's lower than normal, which is bad, usually 40 or depends, but it's so these are the numbers for the normal healthy people to look at. And the other blood tests for the hemoglobin, especially for hemoglobin, you can look at the red blood cells and HCT, hematocrit, but hemoglobin, I think for the general population, it's enough to see whether you have lower hemoglobin or not low or normal. If it's low, that means anemia. So these are the numbers, and lipid, blood glucose, and hemoglobin in terms of blood test. In terms of metabolic, recently molecular diagnostic test results, usually for those people who is taking medication. So I'm not going to talk about it here because this video is for, and those molecular diagnostic test results, your physician will discuss with you, and mainly to guide the physician to prescribe your medication, which medication probably is better in terms of your genetic characteristic. So I'm not going to talk about that here. An image study, for the most of the imaging study has to be interpreted by the professionals. If you're really interested and want to know what to look at, then this is probably you know it, the common sense. If you look at the image, you cannot see any, you cannot see the abnormalities unless you are trained professionals. Just read the, they'll probably say there's a proliferations, calcifications, and dense, and or something like this, or opaque or not opaque. These are not for you to read, so you just read the conclusion, the last line, the impression. Okay, is it something abnormal need to be followed, or something abnormal need to be further tested? Something like this. You look at this, you know what I should do next, or should I call my physician because this image study said I need to be followed. Or in terms of how to follow about what, you talk to your physician. So these are the very fundamental knowledge. I think you probably know it. Just in case for those who did not pay attention, particularly young people, just the test results came back and threw away, and later on realized, oh, there might be something. So just for educational purpose, or just let you know there's something, what kind of results you need to look at it, which is saving your time and helpful. Thank you for watching, and this is about the quarantine special edition, and I'll see you next time.